Hi everyone, welcome to Body Make and Health Management channel. I want to guide you through a particularly challenging area. Today, we're tackling a topic that affects countless families' eating disorders. These conditions don't discriminate, they can impact anyone, regardless of age, gender, or background. It's crucial to remember that you're not alone in facing this. Eating disorders are often misunderstood, frequently dismissed as mere dieting or a phase, but they are, in reality, serious and complex mental health conditions with potentially life-threatening consequences. But clear, compassionate information is the first step to helping someone you care about. Understanding the nuances of these disorders is paramount to providing effective support and guidance. This guide is for parents, caregivers, friends, anyone worried about a loved one. Whether you've noticed concerning behaviors or simply want to be better equipped to support those around you, this information is designed to help. We'll break down what eating disorders really are, exploring the underlying psychological and emotional factors that contribute to their development. The most common types, including anorexia nervosa, bulimia nervosa, and binge eating disorder, highlighting their unique characteristics and potential health risks. Warning signs, those subtle and not so subtle indicators that something might be amiss, enabling you to recognize potential problems early on, and how to approach the situation with care, emphasizing the importance of empathy, patience, and non-judgmental communication. Recovery is possible and hope is essential. It's a journey, not a destination, with ups and downs, but with the right support, lasting recovery is within reach. The goal isn't to diagnose, but to support and empower you to take the next step, whether that's initiating a conversation, seeking professional help, or simply learning more. If you're here because of a concern or simply to be more informed, your willingness to learn matters. Education is a powerful tool in combating stigma and fostering understanding. We'll keep things non-judgmental and focused on understanding. Creating a safe and supportive environment is crucial for open and honest communication. This is a starting point. Professional help is crucial for anyone struggling. Eating disorders require specialized treatment from qualified professionals. Let's begin this important conversation and learn how you can make a real difference in the life of someone who may be silently struggling. Your awareness and support can be life-changing. Chapter 1. What are eating disorders really? When we hear eating disorder, images of food, concerns about weight, or fixations on body image often come to mind. These are the things we tend to focus on initially. But it's crucial to understand that these are merely the outward symptoms, the tip of the iceberg. There's so much more beneath the surface. At their core, eating disorders are serious and complex mental health conditions that require professional attention and understanding. They are deeply rooted in a person's thoughts, overwhelming emotions, and often destructive behaviors surrounding food and their relationship with it. They're often coping mechanisms, albeit unhealthy ones, developed to manage or numb deeper emotional pain and distress. Like underlying anxiety disorders, persistent feelings of depression, or the lingering effects of past trauma, these are significant factors. Controlling food intake, weight, or body shape can, in a distorted way, feel like regaining a sense of control and predictability in a world that feels overwhelmingly chaotic and unpredictable. That's precisely why simply telling someone to just eat or just stop completely misses the underlying issues and the complexity of the disorder. To truly offer meaningful help and support, we must look beyond the surface behaviors related to food and ask, what deep-seated emotional pain is this behavior desperately trying to soothe, mask, or escape from? Shifting our perspective, moving away from solely focusing on food and weight, and instead, acknowledging the underlying emotional struggle is absolutely key to providing compassionate, effective, and truly supportive care. Chapter 2. Common types explained. Eating disorders come in different forms, affecting individuals of all ages, genders, and backgrounds. It's important to remember that these are complex mental health conditions, not simply lifestyle choices, each with unique behaviors, underlying causes, and challenges. Understanding these differences is crucial for effective support and treatment. Anorexia nervosa involves severe food restriction, often stemming from an intense fear of gaining weight. This is coupled with an intense fear of weight gain and a distorted body image where individuals perceive themselves as larger than they actually are. This can lead to dangerous health consequences. Bulimia nervosa is marked by cycles of binge eating, where large quantities of food are consumed in a short period, and purging, through self-induced vomiting, misuse of laxatives, or excessive exercise, all in an attempt to compensate for the calories consumed. Binge eating disorder, the most common type of eating disorder, involves regular episodes of eating large amounts of food in a discrete period of time, without compensatory behaviors like purging, often followed by intense feelings of guilt, shame, or distress. Orthorexia, though not yet recognized as an official diagnosis in diagnostic manuals, describes what starts as a seemingly healthy focus that quickly turns into an unhealthy obsession with clean or pure eating. This rigid focus on food quality and purity can lead to social isolation, nutritional deficiencies, and significant distress. Each disorder, regardless of its specific manifestation, is fundamentally driven by underlying emotional distress, and is not just about a superficial desire to change one's appearance or achieve a certain body weight. Recognizing these patterns and understanding the nuances of each disorder helps us better understand what someone might be experiencing internally. The visible behaviors are merely symptoms. The real struggle lies much deeper, often rooted in unresolved emotional issues or trauma. Therefore, understanding the differences between these conditions is the crucial first step towards offering appropriate and effective support to those in need. Chapter 3. Recognizing physical and emotional red flags. Early recognition can make a big difference, but signs are often subtle. Watch for significant weight changes, complaints of being cold, dizziness, thinning hair, or digestive issues. Specific signs like swollen cheeks, calloused knuckles, or frequent bathroom trips after meals can indicate purging. Emotional changes matter too. Withdrawal, preoccupation with food or weight, rigid food rituals, or sudden mood swings. Compulsive exercise, working out excessively or feeling anxious if a workout is missed, is another red flag. Patterns matter more than isolated incidents. If you notice a combination of these signs, it's time to pay closer attention. Trust your instincts and don't ignore persistent changes. Chapter 4. How to offer compassionate support. If you suspect a loved one is struggling, approach with compassion, not confrontation. Use I statements. Focus on what you've noticed and how you feel, not accusations. Avoid comments about weight or appearance. Focus on their well-being. Ask open-ended questions and let them know your support is unconditional. Educate yourself about eating disorders to better understand what they're facing. Be patient. Recovery is a long, non-linear process. Encourage professional help and offer to assist with finding resources or attending appointments. Frame treatment as a step toward freedom from distress, not punishment. Your steady, loving support can be the bridge to recovery. Chapter 5. Navigating the recovery journey. Recovery is a marathon, not a sprint, and every journey is unique. Setbacks are normal. They don't mean failure, just a need for more support or a new approach. Effective treatment involves a team: medical doctors, therapists, and dietitians working together. Family-based treatment can be especially helpful for adolescents. Recovery means more than restoring weight, it's about building healthy coping skills and self-worth. As a caregiver, celebrate small victories and offer a compassionate ear during tough times. Hold on to hope, even when your loved one can't. Your presence and encouragement are powerful anchors in their recovery. Eating disorders are treatable and full recovery is possible. Your support can be the catalyst for change. Remember to care for yourself too. Seek support if you need it. You're not alone. Many families are on this journey. Breaking the silence and seeking help is the first step toward healing. By starting conversations and learning more, you create a safe space for recovery. Your courage and commitment matter. Share what you've learned. Reducing stigma helps everyone. There is always hope for a brighter, healthier future. Thanks for watching until the end. I hope to see you again in the next video.